To introduce our speaker for today. Dr. Megan Keys is a licensed clinical psychologist in Missouri and Alabama. She specializes in the implementation of evidence-based psychotherapies for adults. She served as an expert consultant for 16 years with the National Center for PTSD's Dissemination and Training Division. And as adjunct faculty with Brown School, Dr. Keys teaches graduate level coursework and continuing education workshops. As a member, of Upward Behavioral Health, she offers the leading evidence-based psychotherapies for adults living with PTSD and prolonged grief, as well as couples experience relationship distress. Dr. Keys is also the founder of Trauma Empowered Consulting, which provides education and public speaking on trauma and mental health related topics. So without further ado, Dr. Keys, I'll turn it over to you.
All right, thank you so much, Evan. I appreciate it. Good afternoon, everyone. Welcome to Open Classroom. Let me just grab our slides. There we go. Okay, so I again appreciate you joining us today. I know that infertility is sometimes a difficult topic to address, so I really appreciate your willingness to spend this hour with us and hopefully learn more about this issue. Right. These are just a few disclaimers. Several of these may already be familiar with. The one that I really want to highlight the most is that bottom one. As I said, this webinar does contain sensitive subject matter, so please feel free at any point to mute the sound or minimize the screen if a given topic is difficult for you. Each module is going to be clearly labeled, so you'll know what topic we're going into before we actually jump into the information or the discussion. So I just want people to feel free and fluid to move in and out of this presentation to whatever degree is comfortable for you. In terms of our agenda, so this is our overview for what we will be covering over the next hour. The first portion of it is really going to be what we know to date in terms of the research that's been conducted about the mental health impact of infertility and associated fertility treatments. The second portion of the webinar is really going to be focused on what can be done about that mental health impact. So I'll be sharing various research kind of based strategies for you, as well as treatment options for individuals struggling with mental health as a result of infertility or fertility treatment. All right. So as I said, most of this you may be familiar with if you've attended our webinars before, but our webinar is recorded and will be posted on our YouTube channel within a few days. You will get a full reference list as well as a PDF copy of my slides. Those will be available on our website. Please submit questions to Evan and we'll try to address as much as we can at the end of the webinar. And finally, that fourth one again is the one I really want to emphasize. Please feel free to engage with each other during this presentation. I'm not able to view the chat box, but I definitely want you to feel free to interact, pose questions, reactions, share resources, so that we can really optimize our time together as a learning community. All right, so my primary reason for selecting this topic for Open Classroom really was to shine a light on an area of women's mental health that is often not part of our national dialogue or conversation concerning women's health. So as you can see, just from some of the research sightings that I have on the slide, research findings cited on the slide, infertility and fertility treatment can have a profound impact on a woman's mental health and well-being. Now, granted, infertility can absolutely impact men as well. Research in this area is slowly expanding, and I'll be highlighting some of these gender differences throughout the webinar. However, the bulk of the research to date on infertility and fertility treatment has been really centered on women, so that will be the primary focus of our content today. I'll also be touching on kind of emerging research with regards to ethnic and racial minorities, as well as our LGBTQ community. All right, so I'd like to begin with just providing some fundamental knowledge about infertility and fertility treatment, which can really be helpful in just simply creating awareness as well as supporting those that are navigating this process. All right, in terms of basic terminology, here are just some key definitions to be familiar with. As you can see, infertility is defined as an inability to conceive a child after 12 months of regularly trying. However, for women over the age of 35, that time interval is limited to 6 months. So after 6 months of trying to conceive, if you have not done so, then you could be considered infertile and may want to consider other options. In terms of prevalence, approximately 12 to 15% of couples, roughly 1 out of 8, will experience infertility in the United States. Infertility affects both men and women almost equally. About 30% of male infertility cases are a result of male reproductive issues like low sperm count, poor sperm mobility, or sperm abnormalities. About a third of infertility cases are due to female reproductive issues, such as various types of ovulation disorders, blocked fallopian tubes, or endometriosis. That remaining third is really typically caused by a combination of both partners or would simply be classified as unexplained infertility. Age plays a really significant factor in female fertility. So women's fertility declines with age, especially after the age of 35, due to ovarian reserve, which is just essentially the quality and quantity of the remaining eggs, as well as changes in menstrual cycles, as we know, because perimenopause can begin to impact women as early as their mid-30s. So, in terms of how the woman's age impacts the likelihood of pregnancy, I just want to share a few numbers with you so you have a general expectations. So, for couples actively trying to get pregnant in their 20s through their early 30s, they have about a 20 to 25% chance of pregnancy with each menstrual cycle. By the time a woman reaches the age of 35, that chance decreases to approximately 15%. By the age of 40, the chance of conceiving per cycle drops to 5 to 10%. And by the age of 45, the chance of pregnancy is typically less than 5%. So I wanted to highlight those numbers for you as they certainly do play a role in individuals struggling with infertility related to age and potentially pursuing fertility treatments. All right, in terms of fertility treatments, these are the two kind of primary categories of fertility treatment that people may opt to pursue are assisted reproductive technology, primarily focused on medical procedures to help the individual or partner conceive, and third-party reproduction, where a use of either donor sperm, eggs, embryos, or a surrogate are used to help achieve pregnancy. Research tells us that approximately 50 to 60% of couples experiencing infertility will seek medical evaluation and fertility treatment. Now, options for fertility treatment really range from basic interventions like lifestyle changes and medication to more advanced procedures like in vivo fertilization. So it's estimated that about 5 to 6% of infertility patients will eventually pursue in vitro fertilization or IVF. One full IVF cycle, as illustrated here on this slide, typically takes 6 to 8 weeks, and many individuals end up requiring multiple cycles to achieve a successful pregnancy. Success rates per IVF cycle range from approximately 40 to 50% for women under the age of 35, but then decline after the age of 35, dropping to about a 16% success rate with IVF for women between the ages of 40 and 42. Now, access to fertility treatment can be especially challenging for our LGBTQ population due to legal and policy barriers in different jurisdictions, lack of comprehensive insurance coverage, access to donors and surrogates, as well as some difficulties legally establishing parenthood. Our racial and ethnic minorities also face some unique challenges when trying to access fertility treatment. Um, there's much broader disparities with regards to access to healthcare as well as socioeconomic barriers. Many are likely to be underinsured or not insured, therefore really exacerbating the financial burden or simply prohibiting fertility treatment from being pursued. And finally, many educational materials and outreach efforts really aren't tailored to culturally diverse audiences. Therefore, a lot of our ethnic and racial minorities just may simply lack the awareness and knowledge of what their fertility treatment options are. All right, and I do want to include this because I think this is worth noting, especially in the context of our current shifting political landscape. A lot of what I cover with you today is really going to highlight the nature of infertility and fertility treatment and how that can impact an individual or a couple. However, I also really want people to be aware of how current events can impact these issues as well. So there have been several studies published since the pandemic that show during COVID-19 and those initial lockdowns of 2020, fertility treatments were discontinued across the United States in many places. And research has shown that for those individuals, that discontinuation really resulted in significant change in terms of their mental health, with many of the patients reporting increased experiences of distress, anxiety, and depression. So just keep that in mind when there is a issue or something that results in a abruption of these fertility treatments and individuals waiting for this fertility treatment, it can have a significant mental health impact. The other thing I want to highlight, especially again in light of our political landscape and over the past several years of reproductive rights and women's bodily autonomy being rolled back, is that abortion care actually can have a big impact on fertility treatment. When you think about it, these are really just two ends of a spectrum. Both abortion care and fertility treatment are about pregnancy and the need for medical intervention or procedures around that pregnancy. So when the Dobbs decision of Roe being overturned on January 22nd of 22, there were a lot of concerns and opinion pieces written among the fertility treatment community about concerns that a lot of states, including Missouri, were proposing abortion restrictions as well as personhood statutes for embryos. Fast forward a couple years until last February, when the Alabama Supreme Court granted personhood rights to embryos and fertility treatments in the state were temporarily paused. So again, as I said, just so important to be aware that although there's a lot going on for individuals and couples pursuing fertility treatment because of the nature of the treatment itself, current events and other types of global crises can have an impact as well. All right, so now I want to shift into the mental health impact. So infertility and fertility treatments have a substantial and multifaceted effect on men and women's mental health, as well as their relationships. Understanding this broad scope of impacts is essential for providing comprehensive care and support for individuals and couples on their family planning journey. And again, it's also important to keep in mind with regards to our special populations. Stress associated with infertility can be compounded for our LGBTQ populations, as they often experience societal discrimination and a lack of support systems, really based on their specific needs. There can be a lack of tailored information and resources available to our LGBTQ population about their fertility treatment options, leading to feelings of isolation and uncertainty. Similarly, for our racial and ethnic minorities, many may experience bias or discrimination within a healthcare system, therefore exacerbating stress. Language differences and communication barriers can make it difficult for individuals to really understand the complexities of fertility treatment, therefore really hindering them kind of having an established, trusting relationship with their providers. And finally, access to culturally competent care, including mental health supports, is critical, but it is an area that's often lacking. So as we go through the different mental health impact of infertility and fertility treatment, just please keep in mind that for our special populations, this can be exacerbated even more so. All right, so I want to begin with just kind of providing information about the really wide range of psychological and emotional reactions many individuals or couples can have to this process. Many find that they experience frequent and intense negative emotions simply due to the challenges and uncertainties associated with infertility and fertility treatment. All right, in terms of depression and anxiety, my goal here was really just to give you some concrete examples of some of the type of things that can occur during fertility treatment that can really contribute to or lead to these symptoms. Depression and anxiety are common responses for both men and women dealing with infertility and fertility treatments. Women often report higher levels of emotional distress and depression than men, and those are often related to the physical demands and the hormonal treatment. Men often experience anxiety and depression, but theirs is often related to feelings of hopelessness, as well as societal expectations about masculinity and fatherhood. Regarding prevalence, studies indicate that among women undergoing fertility treatment, about 40 to 60% report clinically significant symptoms of anxiety, and about 30 to 50% report clinically significant symptoms of depression. Prevalence rates are much lower for men, with approximately between 10 and 30% reporting symptoms of anxiety and or depression in the context of infertility. Right. Infertility can have a profound impact on an individual's sense of identity and self worth, often intensifying feelings of inadequacy or failure. Both men and women may face societal stigma with judgments or misconceptions about their roles in parenthood. Women might experience pressure linked to kind of traditional expectations of motherhood, while men can really struggle with the perceived challenge to their masculinity. This stigma can lead to social isolation and a reluctance to seek support or share their struggles, just kind of further exacerbating that emotional distress. It's also important to keep in mind that diverse cultural beliefs and practices regarding family and medicine can impact how individuals perceive infertility, as well as how they approach fertility treatment. So, this may include preferences for traditional remedies, as well as a hesitancy towards seeking medical or mental health interventions. Individuals and couples often feel alienated from their social circles, especially when they're surrounded by friends and families who are easily expanding their families. The emotional strain and the kind of continued disappointments of failed treatment cycles really can make social interactions very challenging for individuals struggling with infertility, often leading to the tendency to just simply avoid events or conversations that might trigger these feelings of inadequacy or envy or sadness. Once again, our LGBTQ population often may feel isolated due to lack of support from their own family or friends and broader community. They also may encounter fewer role models or peer support groups who have undergone similar experiences. In some cultures, infertility is associated with significant stigma and shame. Again, this can just lead some individuals to really feel isolated and reluctant to seek treatment and support. And kind of just being aware of all of this, it's incredibly important for healthcare providers and support networks to really try to offer compassionate and non-judgmental support to those navigating this process. Okay. And in terms of trauma and grief, so the inability to conceive is often experienced as a loss of an anticipated future, resulting in deep sadness and a sense of longing for many individuals. Each failed treatment cycle or miscarriage can really compound these feelings, resulted in kind of cumulative psychological stress, trauma, or prolonged grief. Research tells us that this repetitive cycle of hope and disappointment can really evoke intense emotional pain comparable to that experienced during with the loss of a loved one. So women may more openly express their grief and trauma, experiencing intense emotional responses such as crying, sadness, and feelings of inadequacy. Men may tend to internalize their grief and trauma a bit more, often exhibiting less outward emotional expression. Research indicates they may feel the need to remain strong and supportive, also potentially leading to feelings of isolation for them. Now, the prevalence of PTSD and prolonged grief disorder in this area of infertility and fertility treatment is growing. Thus, the prevalence estimates are still kind of slowly emerging. Studies to date suggest that about 10 to 15% of women undergoing for fertility treatment may exhibit PTSD symptoms, particularly after repeated treatment failures or repeated miscarriages. Early research suggests that men and women dealing with infertility experience symptoms consistent with prolonged grief disorder, typically linked to, again, repeated miscarriages or the kind of ultimate realization of childlessness. So perhaps we've already kind of laid the groundwork in terms of how relationship distress certainly can be common for individuals navigating this process with a partner. Clearly, looking at the really profound and multifaceted impact for infertility and fertility treatment can have on each individual, when you have both of those individuals in a relationship together, it's not uncommon that conflict and tensions may evolve. I just want to highlight some other key kind of sources of relationship distress that are just important for people to be aware of. First of all, partners just may experience varying degrees of and different types of emotional responses to the same event, whether it be a failed treatment cycle or getting ready to begin a new cycle. These differences in responses often create a disconnect in the partnership. And kind of mutual understanding and support is not always as readily available or easily to provide. The ongoing nature of fertility treatments, kind of coupled with those repeated disappointments, can lead to a real buildup of stress for the couple. This cumulative stress often exacerbates existing anxieties or tensions within the relationship. And finally, it's also important for individuals to understand that the cost of fertility treatments can result in significant fiscal stress for an individual or couple. Fertility medications cost roughly $1,500 to $5,000 per cycle, and an IVF cycle can cost roughly $12,000 to $15,000 per cycle. In addition, third-party reproduction costs, those donor eggs, embryos, etc., the cost of that care can range anywhere from $75,000 to $150,000. So it's certainly understandable that in addition to all of the distress we've already highlighted that this process can cause for individuals, there is also this other layer of kind of accumulated fiscal distress that can occur over the course of this process. It's The pressure to conceive can really transform sex from an intimate act to something that becomes a very goal-directed activity. And this often leads to a loss of spontaneity and pleasure for one or both partners. This shift in their kind of sexual behavior and sexual life can result in decreased satisfaction, increased stress around physical intimacy, and sexual dysfunction. Finally, when we think in terms of partners, when we talk about a power imbalance and role negotiations, decisions about treatment and the kind of the division of responsibility can create an imbalance, especially if one partner feels overburdened or excluded from the decision-making process. Infertility can also really challenge kind of the traditional roles within the relationship, requiring the partners to essentially renegotiate their identities, which can absolutely be a source of tension and conflict. And finally, another layer of complexity for many couples is that there can be ethical and moral dilemmas involved in fertility treatment, such as the use of certain types of procedures, third-party reproduction, or decisions about embryo disposition, which again just adds kind of another domain that couples and or individuals need to navigate. All right, so the information shared so far has hopefully illustrated how and why infertility and fertility treatment can be an emotional roller coaster due to the intense and often conflicting emotions experienced throughout the process. So many begin with high hopes and excitement, often expecting to conceive quickly. But as months pass without success, feelings of disappointment and grief naturally begin to emerge. Each new treatment cycle can really bring a sense of renewed hope, but every unsuccessful attempt at conception can also lead to fairly profound despair. And this really ends up causing the individual or the couple to be caught in this repetitive cycle of these emotional highs and lows. The experience of navigating fertility treatment can be very isolating, as friends and families don't always fully understand the struggle. However, conversely, it can also create deeper bonds with those who offer support or are going through familiar experiences. So, what I'm going to do now is share a range of research based strategies for protecting your mental health and mitigating the negative impact of these various challenges we've discussed. What's important to remember is that our daily choices and daily practices have a significant impact on our mental health, especially during times of prolonged stress and uncertainty. So, my goal is to provide you with a range of options so that you may find the ones that are the best fit for you. All right, so with emotional coping strategies, well, there really is a focus here on on techniques that promote a mind body connection or mind body work. Incorporating these techniques into your daily routine really can provide significant mental health benefits, and also just help you navigate your family planning journey with kind of a greater emotional balance. Mindfulness simply involves staying present and fully engaged in the moment. It can help reduce anxiety and stress by allowing you to really focus on the present moment as opposed to worrying about the future or kind of ruminating on past disappointments. So, practices like mindful breathing and mindful walking can bring a sense of calm and control. Meditation, which a lot of people may be familiar with in this day and age, can promote relaxation. It reduces stress and it improves emotional balance. Research indicates that regular meditation practice really can lead to increased feelings of calm as well as a more positive outlook. Breathing exercises help activate our parasympathetic nervous system, which essentially really counters stress. So it not only reduces stress, but it really promotes a state of relaxation. So techniques like diaphragmatic breathing or the 4-7-8 breathing technique can be practiced regularly to manage stress and anxiety. Similarly, progressive muscle relaxation is another relaxation technique that really helps reduce physical tension and promote a sense of calm. And again, I'm anticipating a lot of folks may be familiar with yoga, and what research tells us is that practicing yoga is found to reduce stress, improve mood, and increase physical vitality. So there are numerous apps available that provide guided mindfulness exercises as well as meditation and breathing practices. Headspace, Calm, and Open are the three that I typically recommend because all three of these regularly conduct research on the effectiveness of their app, and that research is often available on their websites if that's something you would be interested in seeing. All right, in terms of cognitive behavioral coping strategies, we highlighted some of the communication difficulties prior. So, one thing to really emphasize here is that open communication, as best as possible, really can enhance some emotional support and strengthen relationships. It helps reduce those feelings of isolation that are so common, and it really promotes a sense of shared understanding and empathy, especially between two partners navigating this experience together. Problem solving, identifying challenges, generating potential solutions, and implementing them can create a sense of control and reduce anxiety. So, this may include planning strategies for financial planning, potential treatment decisions you're going to need to make down the line, or other anticipated issues associated with fertility treatment. Goal setting is something that has been found to really provide individuals a set of purpose, accomplishment, and empowerment, which can be very helpful to balance those emotional ups and downs of infertility and fertility treatment. So, setting small, achievable goals in your life, whether it be related to your fertility journey or other domains of your life, really can boost confidence and create a bit of a positive momentum. Journaling, writing about your thoughts and feelings can provide clarity, reduces stress, and offers a productive outlet for difficult emotions. A lot of body of research shows that journaling really promotes emotional processing and self-awareness, which means it's going to allow you to better understand and more clearly articulate your feelings, whether it be for yourself or to others. Um, Identifying and challenging really extreme negative thoughts, kind of intentionally reframing them in a more balanced or constructive way, can enhance emotional well-being. That's really the basis of cognitive behavioral therapy, and we're going to chat about that a bit more shortly. And that final bullet point, which again, I always feel silly reminding people of this, but it's always important to be said. Healthy lifestyle. Stress takes a tremendous toll on our bodies physically. So engaging in regular activity, healthy diet, adequate sleep are all things that you can do to really combat the negative impact of stress on your body physically, as well as help improve your emotional or mental state. All right, when it comes to social coping, I want to give, as we've kind of already covered, the isolation and social withdrawal it can be a huge component of infertility and fertility treatment for many people. And our social coping skills are really a way to try to combat that as much as possible. So in terms of disclosure, choosing someone who you feel safe with to confide in and clearly communicate your needs and limits regarding discussions of infertility can be very helpful. Sharing your struggles with trusted individuals can provide emotional support and reduce those feelings of isolation. Setting those boundaries in terms of, are you open to them asking questions? Do they just want to follow your lead if you bring it up as a topic of conversation? Setting those boundaries can really help you manage your emotional needs and comfort when disclosing this information to someone else. Local or virtual support groups. So research tells us that support groups are helpful in the sense of giving individuals an opportunity to share experiences, seek advice, and engage and gain encouragement from other individuals in a similar circumstance or situation. Many fertility clinics, as well as third-party reproduction programs, offer a range of such groups. So it's certainly something to investigate. Also can consider participating in a reputable online forum or social media group. This can be another means of asking questions, sharing information, and receiving support at any time. The accessibility of these online groups really allows individuals to connect and share experiences much more readily and with a much broader community. There are local organizations such as Resolve, the National Infertility Association, which provides support groups, education, and advocacy initiatives. And finally, in terms of social coping, educate yourself. Attend workshops or seminars or webinars or lectures to gain knowledge and practical advice, but also support from professionals and others going through similar experiences. Okay. All right, so when we transition to talking about therapy or treatment options, a lot of what I'm going to share with you right now really applies to psychotherapy across the board, not just in the context of individuals struggling or navigating infertility and fertility treatment. So that information on the next couple slides, I want you to please consider as just good general guidelines for considering psychotherapy and engaging in psychotherapy if that's something that you are currently looking to do or decide to do at some point. So pursuing therapy can be really helpful as it equips individuals with coping strategies to navigate life's challenges. And in our case of infertility and fertility treatment, therapy can often provide some solid skills that are going to help you really navigate this often very overwhelming emotional journey, ultimately kind of contributing to better mental well-being and a more balanced approach to the fertility treatment process. For those not pursuing fertility treatment, psychotherapy can be very beneficial in processing grief, as well as coming to terms with not having children. So when thinking about treatment, it's often helpful to begin with the understanding of why treatment is important. A very common question that comes up often is, Why should I consider therapy? If I've been experiencing anxiety or depression for a while now and I'm getting by, why should I consider or why would I need therapy? Um, Therapy is worth considering because there just is simply no need to live with the unwanted consequences of depression or anxiety in your life when effective therapy is available. Mental health struggles such as these, as well as PTSD or prolonged grief disorder, we can fill in the blank. A lot of these psychological issues have been found to really negatively impact a person's relationships, work, school performance, and quality of life. Time limited, targeted psychotherapies for a lot of these common mental health issues are available. In many cases, treatment results in a reduction, if not an elimination, of symptoms. In addition to symptom reduction, research indicates that many individuals find that treatment really improves their relationships and enhances their quality of life. Also, another way to think about psychotherapy and treatment is that many of these evidence-based therapies involve learning a set of skills that are not only used to address your current mental health systems, but can be used to navigate struggles in real life. These skills can be applied to new stressors, difficult decisions, or troubled times, such as pandemics. Therefore, therapy really isn't just about gaining symptom relief now, but it's about acquiring a helpful skill set that you can absolutely utilize going forward. All right. So if you are or have kind of investigated the possibility of psychotherapy, you've probably stumbled on evidence-based or empirically supported terminology quite frequently. So I just want to kind of explain what this means and why personally as a clinician for over 20 years, I've just been a huge advocate of evidence-based treatment and therapy. So, evidence based therapy simply refers to treatment that is backed by science. Extensive research studies are conducted to determine if a given psychotherapy or treatment is effective in treating the specific mental health issue it was created to address. In well designed treatment outcome studies, the effectiveness of the therapy is objectively evaluated to reduce any prejudice or bias, and these studies are often published in peer-reviewed scientific journals. And what that simply means is a group of experts in that field carefully review the study to ensure it was well designed, it was correctly implemented, and the results are reliable and valid. Once this has been established, that study and its findings can be distributed to the field through publication. So that really is the piece of just to be really aware of what evidence-based means if you are seeking psychotherapy. It can be as simple as a Google search, such as the leading evidence-based therapy for depression or anxiety or PTSD. You will often see the names of the leading therapies come up there and now with Google and AI, you'll also see links to articles, scientific articles about them. All right, so what I have listed here are really currently our leading evidence-based psychotherapies for a range of mental health issues. One thing that's important to keep in mind with the mental health impact of infertility and fertility treatment, there is not a specific treatment protocol or evidence-based treatment protocol that has been developed that really targets the mental health impact of infertility. Now, part of that is because, as you can see from what we've spoken of, there can be a range of mental health responses and reactions to infertility and fertility treatment. So certainly it's not a one size fits all. However, the therapies that I'm listing for you today, especially the top three, these are all evidence-based treatments that have been studied in individuals struggling with infertility and fertility treatment. So we know that there is a level of evidence there showing that it's been effective. So currently, the leading psychotherapy that has the most evidence behind it for addressing the mental health impact of fertility treatment is cognitive behavioral therapy for anxiety and for depression. You know, as we noted, this is far more common than PTSD or prolonged grief disorder, at least at this point, based on what we know. However, this is not particularly surprising because if we move out of the mental health impact of infertility and fertility treatment, cognitive behavioral therapy, or CPT, has been the leading evidence-based treatment for depression and anxiety for decades. It's a very, very well-established treatment for these issues. Um, However, when we look again specifically at the mental health impact of infertility, mindfulness-based stress reduction is another type of therapy that has growing evidence behind it. I think it's fair to say is sort of ranked next below the cognitive behavioral therapy. If you're interested in cognitive behavioral therapy, what it really does is help individuals change unhelpful beliefs and behaviors that are really contributing to their emotional distress. So, CBT can absolutely help reduce emotional distress. Research shows it improves overall mental well-being. And again, within the context of fertility treatment, it can really help you progress with a much more balanced and positive outlook during this process. Emotionally focused couples therapy is the leading evidence-based treatment for couples experiencing relationship distress. And again, studies have been conducting using it with couples who are specifically experiencing challenges related to infertility and fertility treatment, and it was found to be effective. EFCT really focuses on strengthening the emotional bonds and improving communication between two partners. It helps couples navigate the emotional challenges of fertility treatment by really fostering empathy, trust, and mutual support. Okay. And then finally, as we've noted, the prevalence of PTSD and prolonged grief disorder is still essentially being investigated and researched. So our research in that area is emerging, though it's still much less compared to some of these other therapies. What I have listed here for PTSD are the three kind of leading evidence-based psychotherapies for that issue. These trauma-focused therapies are endorsed by numerous major health organizations for their effectiveness in alleviating trauma-related distress, as well as improving overall functioning. And then finally, our prolonged grief disorder therapy. This is a specialized form of cognitive behavioral therapy that's really tailored to address some of the unique aspects of prolonged grief. And this includes revisiting the story of the loss to promote acceptance, addressing a lot of the trauma-related distress, and really helping the individual foster a reconnection with their life, moving on past the loss. In terms of resources, again, I just want to highlight some things that I thought may be particularly beneficial for people viewing this today, whether you're viewing this for professional or personal reasons. So beginning with professional assistance. So, part of adaptive coping and protecting your mental health is seeking professional assistance when it's needed. However, that often raises the question for many people of how do I know if I need therapy? So here are just some potential indicators to keep in mind regarding whatever changes or symptoms you may be experiencing. If these symptoms have become excessive, they are occurring more often than not for an extended period of time. General rule of thumb is a couple months. If these changes have been distressing, they feel unmanageable or out of control, or they're creating conflict in your relationships. If these mental health symptoms impair your functioning, so essentially it just means whatever mental health changes you have experienced, those changes are now either interfering or preventing you from doing what you need to do and what you want to do. And then finally, and this is a big one, safety concerns. If there are just any thoughts of hurting yourself or others, frequent thoughts about death, even those vague better off dead feelings, these are all indications that seeking professional assistance is warranted, at least for an evaluation to get a better sense of what's going on and what can be done. I did want to provide these two websites, which are very helpful if you are kind of considering therapy or in type of mental health crisis. So Psychology Today is very user friendly. It allows you to search for therapists based on your zip code, your insurance coverage, the type of therapist you would like, as well as the type of therapy. So if there is a particular psychotherapy you've read about or heard about and are interested in, you can search to see which therapists in your area actually provide that. The 988 Lifeline is really just a crisis hotline. I just always want to ensure people have access to this line, either for yourself or others. So it is a 24/7 confidential resource for individuals in emotional distress or crisis, or with a loved one in crisis. And their website also provides a wide range of resources as well. All right, so Upward Behavioral Health is a private practice based in Birmingham, Alabama, that offers teletherapy services throughout most of the United States. I'm a member of this practice, and our goal is essentially to provide the most effective psychotherapy that science has to offer, making these leading evidence-based therapies more readily available and accessible. We also really strive to raise awareness and promote knowledge about mental health issues and treatment options. So if you would like to learn more, please feel free to join our Upward community by following us on social media or connecting with me on LinkedIn. And finally, here are just some websites that are particularly helpful because they just provide a wide range of resources. So I wanted to make sure you had those at hand in case those would be helpful to you. This is my contact information if needed for any reason. You will have a full reference list provided and uploaded on our website later today or possibly in the next few days. And that concludes our content for right now. So we can go ahead and turn it over to Evan for questions and discussion.
Yeah, we have a couple questions here, and if anyone has more questions, please feel free to put them in the chat. But yeah, one question, I know you just shared some great resources there at the end, but one question was, are there additional resources or reading that might be useful to someone who wants to understand more about the clinical side of these like evidence-based treatments?
Yes, there are. And I just realized I thought I had them with me and they're upstairs. So the one that I would recommend, well, let me back up for a second. For clinicians or therapists, one of the books that I have found incredibly helpful, and it doesn't necessarily go into the specifics of evidence-based treatment just yet, but it provides a really wonderful conceptual framework for working with individuals struggling with infertility and fertility treatment. The title of the book is called Reproductive Trauma, and the author is Janet Yaffe, Jaffee. She just published the second edition of this book last year in 2024. And she provides a really great framework of how to really think about and approach reproductive issues like infertility in terms of the impact it can have on a family. And she also gives a really kind of solid guidelines on how to explore this and work with them in therapy. So that's one that I really recommend. In terms of the evidence-based treatments that I cited for infertility, there's not a book that I'm aware of that specifically covers those. I would say there's a lot of information about them online. If that's something that you're interested in and kind of just learning about those therapies specifically. With the PTSD therapies, the National Center for PTSD, www.ptsd.va, offers a lot of information about those. You also can sometimes look to professional organizations. So there is I'm blanking on the acronym, but there is one for cognitive behavioral therapy. I suspect if you just Google Cognitive Behavioral Therapy Professional Association, you will find it, or organization. And they often have a lot of resources there as well. And a lot of these places do also offer kind of online training and seminars in these therapies. So that may be another option in terms of where you might be able to learn more about this. With prolonged grief disorder, the Prolonged Grief Center at Columbia University offers online trainings. They have incredible, that's where I was trained. They offer really great resources online. And so for folks interested in prolonged grief, that's probably the best resource I could recommend for you, since Kathy Shear runs that center, and she's the one that actually discovered and coined the term complicated grief or prolonged grief.
Thank you. Another question we have here is, let's see, where do you see, or how do you see kind of the future of infertility treatments and their mental health impacts changing in the near future?
Oh goodness, that's a big one. We actually did an open classroom on this last year around the abortion restrictions right after the Alabama decision. So if you ask me personally what I think based on the way things have gone so far, it will not surprise me if we continue to see more restrictions in place that could potentially impact individuals going through this process. I will say this, the thing that I think is so important for people to remember is that when some of these changes come about, like when the Alabama Supreme Court issued personhood rights to embryos, even though fertility treatments were reinstated and people were able to resume, we have to remember so much about that initial mental health impact. One of the studies I cited that like 52% of the women participating in a fertility treatment in, I believe it was Chicago, reported, significant symptoms of depression, and they weren't even in Alabama. So that's the thing to really keep in mind is how this sort of perceived threat can have such a mental health impact on individuals going through this process, as much less if they're in a state where it may impact them directly. So as a clinician, I feel like it's something just incredibly important to be aware of for your clients, even if they aren't as fully tuned into it. And the organization Resolve, it's on the resources list. That's our uh, National Infertility Association, but it's called Resolve, RESOLV. They actually do a lot of initiatives and advocacy around this very issue. So even if you just follow them on social media, you're really able to keep up to date kind of nationwide on what's changing in this particular area with policy and politics with regards to fertility treatment.
So, great. Sound like great resources. I think that might be all our questions we have for today, and
Okay.
just all our time. Just want to say thank you again, Dr. Keys, for the presentation.
Certainly.
Another reminder, we'll be posting and recording this program on our Open Classroom page. You can view it along with our other 200 or so, more than 200 past Open Classrooms. March, of course, is Social Work Month, and we have another Open Classroom coming up next week with Dr. Keys talking about PTSD, mental health, and unraveling that impact. So a link to register for that is in the chat here. I'll be posting that here.